Welcome to Maestro Conference. Please, this call may be recorded. Thank you. You will now be connected.
This is the 2-minute warning. Please press 1 to ask a question.
Good afternoon, everyone, and thank you for joining our update on COVID-19 in North Carolina. As of today, we have 21,618 confirmed cases, 568 people in the hospital, and 728 deaths. We continue to mourn for their families and their friends. Well, today at 5 p.m., North Carolina enters Safer at Home Phase 2. As laid out, this is a cautious step forward that eases certain restrictions and keeps important safety measures in place. This is Memorial Day weekend, and it's an important opportunity to honor our men and women in uniform who've made the ultimate sacrifice. And it's time to reflect on their contributions and show gratitude to their families. I am deeply grateful for these heroes who gave everything for our country. And I know it's also a popular weekend for cookouts and parties, especially this year when we've been more socially isolated. The desire to gather with friends and family is really strong. I want you to have a great time, but continue using caution. I urge all North Carolinians to take the COVID-19 restrictions and safety rules seriously. Keep gatherings to under 10 people indoors or 25 people outdoors. And remember the 3 W's: wear a face covering, wait 6 feet apart from other people, and wash your hands frequently. This is how we protect ourselves and particularly protect our families and our neighbors. Starting at 5 p.m. today, restaurants can open for in-person dining at 50% capacity and will use enhanced cleaning and health screening. Restaurants are a major part of our economy, and this virus has been tough on them. As we enter phase 2, I appreciate that restaurant owners across North Carolina are focused on how to keep their customers and their employees safe. They know that strong safety precautions will be good business. To help this effort, the Department of Health and Human Services has been working closely with the North Carolina Restaurant and Lodging Association, North Carolina State University Extension, and Visit NC to develop an online curriculum for owners, managers, and employees of restaurants, hotels, and other businesses. It's called Count on Me, NC. Count on Me is a free online training, It's focused on advanced cleaning, disinfection, social distancing, and hygiene practices to better protect the public and employees from exposure to COVID-19. When completing the course, restaurants and businesses will have a sign in the window and a logo for their website to show their commitment to using new safety protocols. You may see your server if you go into a restaurant this weekend. They'll be wearing a Count on Me pin or a name tag. So far, over 3,500 individuals representing over 1,800 businesses have completed the training, with more signing up every day. You can learn more at countonmenc.org and find a list of businesses in your area that have already completed the training. This innovative effort is possible because of the strong and long-standing partnerships we have with industry and our universities. As far as we know, it's among the first of its kind in the country, and I'm proud that North Carolina is leading the way on safety and best practices. Today we have with us Lynn Mingus, the President and CEO of the North Carolina Restaurant and Lodging Association, to share more about this effort. So Lynn, if you'd like to come over and tell us about it, please. Thanks.
Thank you so much, Governor Cooper, for your leadership, and I appreciate very much the opportunity to share more about this important public health initiative as we prepare for reopening North Carolina restaurants today. There is no question that North Carolina's restaurants and our hospitality community have been significantly impacted by this pandemic. But during this challenging time, we've looked for ways to help our community to prepare for our reopening that begins as early as this afternoon. With that in mind, we've come together with our esteemed partners, and we've spearheaded an initiative called Count on Me NC. It's designed to address safety concerns, but also to instill consumer confidence as we welcome visitors back into our restaurants this evening. As North Carolina's restaurants and hotels and attractions and museums work together to greet visitors back, Count on Me NC is really a mutual pledge, a public health initiative that empowers guests and businesses to work together to protect everyone's safety. This program is an acknowledgement that we're all in this together, and Count on Me NC conveys a sense of mutual responsibility as the hospitality industry prepares to welcome guests back into our dining rooms. Customers will appreciate the commitment that our businesses are making to protect their health, the health of other patrons, and the health of our employees. At the same time, we expect our visitors and consumers who come back into our establishments to take responsibility for their actions to protect other customers and our employees. I want to tell you a little bit more about this initiative. We've worked collaboratively, as we do every day, with the North Carolina Department of Health and Human Services, as our restaurants are heavily regulated and inspected on a regular basis. We operate under very strict protocols every day, but particularly so during COVID-19. We're also proud to have in our partnership Visit NC, our state's tourism marketing arm, who works hard to greet visitors who choose to come into our state, to stay in hotels, to eat in our restaurants, and to visit our many attractions and retail stores. They will play an important role in helping to assure consumers that our businesses are prepared and ready to welcome them back. And then last but certainly not least, we are proud to partner with North Carolina State University's Dr. Ben Chapman and his team. They are renowned experts, national experts, on food safety. They, in fact, have been a part of working with the CDC and the FDA on guidance at the national level as we prepare nationally for best practices in safety in food service establishments across our state. Dr. Chapman also plays a vital role here in North Carolina as he has been a part of the farm-to-table movement in helping make sure that North Carolina-grown products make their way safely to the tables of families and restaurants across our state. The first phase of this training is already underway, and as Governor Cooper mentioned, over 3,500 businesses have completed the program already this week. In addition, we expect that is about 10,000 employees who have already been trained, and more will be trained as additional establishments across our state reopen. The training modules are for restaurant managers and owners. There's a second module for back-of-the-house employees, another for front-of-the-house employees, one for cleaning staff, and one for other hospitality and retail establishments. The public can look for certificates and Count on Me logos in windows and doors, on menus, on websites, all over the state, and can know that these establishments have taken extra precautions to ensure guest safety during COVID-19. Participating businesses will be listed on the countonmenc.org website, and consumers who want to know about these establishments can search by keyword or by map. We also encourage North Carolinians to go on the website, to read about the protocols that we're taking, and to sign their name to pledge that they're going to participate in this campaign to ensure guest safety and the safety of others. We all have a role to play in keeping our communities safe and healthy when visiting restaurants, businesses, and other public places. And we know that North Carolinians are ready to do their part. So we encourage you to take the Count on Me NC pledge. And remember the 3 W's: to wear, wait, and wash. To use contactless delivery options and drive-through if you've been exposed to COVID-19 or have symptoms of COVID-19. But perhaps most importantly, we encourage you to be patient and kind and respectful of each other as you come back into dining rooms across North Carolina. We welcome you back, and we welcome the partnership of local health departments across the state who we work collaboratively with every day to ensure public health safety. At the heart of it all, Count on Me NC is about working together with businesses and customers, showing mutual respect for each other in this brave new era that we all find ourselves in. I thank you so much.
Thank you, Lynn. The Count on Me campaign is really a testament to the collaboration going on all across our state right now as we fight COVID-19. And I know you'll continue to partner with all of us and to continue to provide the type of helpful information and training to all of your members. Thank you for being here and for telling us about that program. We have with us today our Secretary of Health and Human Services, Dr. Mandy Cohen, our Secretary of Public Safety, Eric Hooks, our Director of Emergency Management, Mike Sprayberry, and our Commissioner of Prisons, Todd Ishii. Nicole Fox and Karen Magoon are our sign language interpreters, and behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. We'll ask the media for their questions, and if you could identify yourself and your organization, and we can take the first question.
Our first question will be from Stephen Reed, Associated Press.
Hello, Governor. With the, of course, the Coca-Cola 600 coming up this weekend, how confident are you that the 4 days of racing at Charlotte Motor Speedway can be done safely? And did North Carolina health officials learn anything or see any concerns when they attended the health screening process at Darlington?
Well, thank you for that question. Our health officials have worked closely with NASCAR and the Charlotte Motor Speedway to ensure a safe Coca-Cola 600 this weekend. I know a lot of people are looking forward to this live sporting event on TV. I know that I am, and we're glad that since NASCAR, North Carolina is the home of NASCAR, that we're going to be having this event here. NASCAR was very thoughtful in their plan for protecting employees and drivers and pit crews and people working on the cars from COVID-19. They submitted a plan to our Department of Health and Human Services. Also, local health officials worked with them. Our local health officials gave them feedback on the plan, and I think that they are ready to put on a very safe race. Obviously, no spectators will be there, and that is because we know that gatherings together, when people gather together, that the risk of infection is so much higher, and this is why we continue to have in our executive order the mass gathering ban. I don't know about the situation regarding Darlington. Do you know anything about it, Dr. Cohen, about any feedback we got? From everything I've heard, things went fine there, but we'll get any reports back to see if any changes are going to be made at the Coca-Cola 600 from things learned at Darlington, but I don't have the answer to that right now. Thanks. Next question.
Kenny Beck, WXII.
Hi, Governor. Kenny Beck here, WXII 12 News. My question for you is about youth sports. The only part of the executive order that explicitly mentions sports dealt with, we presume, NASCAR, because it mentioned for broadcast on television. We've been getting a lot of questions from Little League administrators and other youth sports coordinators, swim team, travel basketball, you name it. Is that, in your opinion right now, a phase 2 thing, or is that a phase 3 thing, or is it somewhere in between?
Sports are so important to the formation of character, for fitness. I love sports. I grew up participating on sport teams all the way through high school, and I know how important they can be for the education of children. So start out knowing that this is something that we want to have happen as much as we can as we approach the school year. At the same time, we have to understand the presence of COVID-19, and I don't think that we have all of the answers to those questions yet. I know that our staff is working closely with the North Carolina High School Athletic Association, and I think I'll let Dr. Cohen come up and make a few comments about that and what she has been doing on that front.
Thank you, Governor. So as far as high school and other youth sports, we'll be putting out guidance today on that. And it is recommendations. So the reason you didn't see it in the executive orders, there are no requirements, but we do have public health recommendations for folks, particularly that run the leagues and the facilities that host these sporting events. Our recommendations generally fall in one big bucket here is around contact sports. We know that contact sports like basketball or football, where you're in each other's personal spaces and you're breathing out respiratory droplets on other, we know that is a higher way of spreading the virus, as opposed to non-contact sports like tennis or baseball or individual sports like swimming or golf. Those non-contact sports, we said that is fine to proceed from a recommendation perspective, but then we do have some guidance on how to do each of those activities safely. So we're not recommending contact sports go forward, but for non-contact sports to go forward, but with a set of guidelines. Again, all of these are recommendations, and we've worked, as the governor mentioned, with athletic associations across North Carolina. We hope to have that guidance posted today for folks to take more of a look at. Thank you.
Thank you, Dr. Cohen. Next question, please.
Joe Bruno, WSOC.
Hey, Governor Cooper, this is Joe Bruno from Channel 9. Hope you're doing well. My question for you is, are you personally comfortable with eating inside of a restaurant this weekend?
You know, I've been two places. I've been the executive residence, and I've been here at the Emergency Operations Center. Yes, I would feel comfortable going to a restaurant, not saying that I'm necessarily going, because I hope I can spend some time with my family this weekend. We're continuing to work on issues here, and we'll be working through the weekend. But yes, I would feel comfortable. I would certainly want that restaurant to be following all of the personal safety rules and doing everything they can to prevent the transfer of COVID-19. But we hope that people will feel safe enough to go to our restaurants throughout the state, and we hope that all of the restaurants continue to obey the rules. And I think they'll find that that's good business for them to do that. Thanks. Next question.
Jonah Kaplan, ABC 11.
Hi, Governor. Wanted to ask you, please, what kind of conversations are you having with large entertainment or convention venues? Should they expect to be closed for months to come? And Dr. Cohen, good Shabbos, is the state tracking the number of positives that are from asymptomatic versus symptomatic people? Is that a metric we could have soon? Thanks very much.
Yes, and I'll let Dr. Cohen address both of those, but our office is having conversations with these large event venues who obviously want to begin the process of having people back in them. These are the kinds of places that are much higher risk for COVID-19 and transferring it from one person to another. So obviously right now, where we are in phase 2 of the executive order, we wouldn't have any of these large gatherings, but we're certainly planning ahead for the potential of them being open at some capacity and are trying to figure out exactly what that would look like safety. And I'll let Dr. Cohen answer both of those questions if you would.
Hi, Jonah. So let me do the symptomatic and asymptomatic. We do not track that for all of our cases, but what I would draw your attention to on our website and on our dashboard, we post surveillance data, and I would direct you to that surveillance data, which does show some information that we are starting to collect about symptomatic and asymptomatic spread. As we've been talking about related to COVID-19 is that we are seeing a fair amount of spread of this virus by folks who don't have any symptoms, who are asymptomatic. That is one of the primary reasons why the 3 Ws is so important. So we are not tracking that for all of our cases. When we get information back from the lab, it's very minimal data. There are certain places where our public health team does more in-depth study, particularly the surveillance kind of work and prevalence kinds of studies. Those are the things where we're going to be able to get more symptom-based information and link it with some of this data. So I direct you to our surveillance data to start. And I'll just echo what the governor mentioned about large venues, right? We know mass gatherings are places when folks, particularly when they're indoors, close together for longer periods of time and sitting, right? Those are the places where they're higher risk. We actually know that North Carolina's first cases here in the state were seeded from a mass gathering up in New England. So we know that those kinds of events have huge implications, not just for here in North Carolina, but can cross state lines. So those are things that are concerning. We definitely want to take precautions as we go here. And I think that we're trying to step through that. We want to look at our numbers and understand how are we doing with the easing of restrictions that we're putting in place that only just start this evening. Let's look at our numbers and we'll see as we go here. But again, mass gatherings is one of the hardest because it does bring so many people together and has such a high risk of spreading the virus to so many people at the same time. Thank you.
Thank you. Next question, please.
Kern Huey, News and Observer.
Governor, this is Kern Hughes from the News and Observer. Thank you for taking my question. I have a question here. Okay, sorry about it. I had the list here. What is the responsibility of restaurants, businesses, churches, anything now open from the public to report to the public and the state about new cases or outbreaks tied to their establishments? This would apply to staffers and diners.
I'll let you handle that, Dr. Cohen.
Sure. Thank you. There are certain industries that are regulated in terms of required to report to us. As was mentioned, the restaurant industry is highly regulated, and we continue to do inspections. But in terms of reporting outbreaks, that would be 2 or more cases, or reporting clusters, that would be 5 or more cases. Restaurants are not one of the industries that are required to report back to us. Now, we often do want those restaurants to get in touch with our public health departments if there is an issue, because we want to work in close collaboration with them to make sure that they're doing all of the right things to prevent further spread of the infection. But there are just a few industries that are required by law to report to us. Those are settings like nursing homes. And again, that's why you see those reported on our website. Thank you.
Thank you. Next question, please.
Matt Debnam, Washington Daily News.
Hi there, Governor. Matt Debnam here with the Washington Daily News. I wanted to ask you about lawsuits. First, there was the suit on behalf of churches, and then one that was going to be filed on behalf of salon owners. Now, our state representative for Beaufort County is organizing a suit that, if successful, would allow all businesses to reopen in Phase 2. What's your reaction to these legal challenges, and are they affecting how your team's making policy?
You know, it would be irresponsible to remove restrictions all at once. Clearly, that's a situation that could result in a massive spike in COVID-19, and our entire effort here has been to slow the spread and to keep our hospital system and medical providers from being overwhelmed. And we've been successful with that. We are beginning to turn the dimmer light up to move into we moved into Phase 1 first. Now we're moving into Phase 2, and we are slowly easing restrictions here while remembering that the vast majority of businesses in North Carolina can be open. Some of them are not because of the consequences of this pandemic, whether it be supply chain, whether it be employees that have to stay home. There are businesses that are not operating at full capacity for a lot of reasons. You know, we hope that we have made these orders constitutional. We did have the one lawsuit regarding houses of worship where we've made accommodations for that in this order. And we believe that this is a smart way to move forward to protect the health of North Carolinians while also trying to boost our economy. And that goes hand in hand. And we've got to make sure that people have confidence to be able to go out into the economy. And we're doing that and giving them that confidence by talking about things like Count on Me today, but also using the data to make decisions about when it's safe to do more easing of the restrictions. And when people know that that's what we're using to make decisions, not emotions, not politics, but science and data, people will have more confidence, and not only will people be healthier, but our economy will improve faster. Thank you. Next question.
Tyler Dukes, WRAL.
Governor, this is Tyler Dukes from WRAL. Today, Senator Berger sent DPS a letter demanding answers to questions and documents that reporters have been asking for weeks. Do you intend to ensure DPS will provide those answers and documents both to Senator Berger and the media?
Well, first, we want to make sure that all our employees at prisons and inmates are safe, and we want to make sure that we abide with all of the public records laws. I've not seen this letter you're talking about, but I do have Todd Ishii here, from our Director of Prisons, who can provide a response. So, Todd, I'll let you come forward.
Thank you, Governor. This morning I did receive communication from Senator Berger's office, and we'll be sending a response back very timely. We look forward to the opportunity to answer all of the Senator's questions, and quite frankly, we look forward to the opportunity to set the record straight. Thank you.
Thank you. Next question, please.
Ashley Fahey, Charlotte Business Journal.
Thanks, Governor. Can you provide more clarity on how craft breweries in the state are classified under the Phase 2 guidelines? The NC Craft Brewers Guild and others have said they don't believe breweries, tap rooms, or brew pubs meet the order's definition of a bar, but there seems to be a lot of confusion around this as far as reopening.
Right. Our legal team and our departments will be issuing guidance on that this afternoon regarding what establishments fall under what category. There will be a legal distinction there. It's important to know that we have worked very closely with the Restaurant Association, making sure that we put in place protections with this Count on Me and See program that is going on right now, and we feel really good about where we are with our restaurants, but that clarification will be coming this afternoon. Thanks. Next question.
Elizabeth Ann Brown, Asheville Citizen-Times. Hello, Governor Cooper. This is Elizabeth Ann from the Asheville Citizen-Times newspaper. Since about April 10th, I've been reaching out consistently with the Department of Employment Services or Security, rather, asking them for just one metric, the number of individual applications they either accept or reject every day. Through several exchanges of emails, they have promised to give me these numbers, and then either those have never materialized or they've cited vague concerns with timing, that it wasn't the right time to answer those. Your PIO has tried to help me get those numbers, and we have not been successful so far. Is there a reason that you know of that DES wouldn't provide those numbers to the public? It's an important metric to show how quickly they'll be able to dig themselves out of the backlog, and one that they should have readily accessible if they're monitoring their progress.
Thanks for that question, and I'm not familiar with that number that you are talking about. They do post numbers of claims that were rejected and claims that have been paid, and right now about 585,000 people are receiving benefits of almost $2.4 billion. But this division knows, and I know, that there are thousands of people who have yet to be paid, and every single family that has applied for unemployment benefits deserves a fair adjudication and deserves to get paid if they qualify. I know that additional federal money has been activated today, so there will be more opportunities for people to provide unemployment insurance. But I'll take those concerns that you have today and make sure that our communications people get up with you to provide that information to you if that's something that can be provided under the public records law and it's supposed to be given out. But thank you for that question, and we'll try to get that information to you. Next question, please.
Our final question today will be from Derek Dellinger, Fox 46.
Thank you for taking my question. This is Derek with Fox 46. We've heard from gyms who have said that they have spent literally thousands of dollars to be ready on everything from air purifiers, hand sanitizers, body wipes, different protocols. We've also heard from bars saying that the restaurants literally right next door to them can open that have bars in them, but they can't. And they say they're willing to do whatever they can to open. And the big question here is, do you have anything to say to those businesses that have invested the time to get ready, only to be told no, even though they were expecting to open? And do you expect the bar and gym restrictions to continue for the next 5 weeks?
We appreciate all the businesses in North Carolina and certainly are concerned about those that can't open right now, but we have to keep the public health and safety of North Carolinians as the #1 priority here. Our Department of Health and Human Services, we're going to continue to work with those businesses, but many of them are high risk for transfer of COVID. For example, the state of Georgia, which has moved a lot faster than North Carolina in easing restrictions, still has not opened bars in Georgia as of right now. And I think we all would know the reason why that would be the case. So what we're doing is moving cautiously, trying not to move with haste, making sure that in this phase we can watch our numbers to see how North Carolina is doing, and then hopefully we can include those businesses as we move on through the phases in North Carolina. But we've got to keep the safety of North Carolinians as the #1 priority. Thanks very much for being with us today, and I hope everyone has a wonderful Memorial Day weekend. Thank you so much.